Yeah, my philosophy is actually slightly different. I don't think you can replace neurons very easily in the brain. All my neurons were born before I was. And what I mean by that is your neurons are born very early and before you're even born, and they're almost all connected then as well. The long connections are done. So the challenge is in an adult 60-year-old brain that's all connected, how do you put new neurons in? And in fact, putting new neurons in can be somewhat detrimental. If they incorrectly connect, they can cause seizures or cause problems or cause bad effects. So I've always been a proponent of the astrocyte. Now, every neuron has around 3 astrocytes surrounding it. These are the support cells of the human brain. And so my strategy in my research has been to replace the astrocytes as you age, and then you support those fragile neurons by putting in a new astrocyte. That neuron maybe will get a boost. It's still connected correctly, but it will last longer. So the astrocyte replacement, I'm very interested in. I'm interested in growth factors like GDNF. So we've actually engineered the astrocytes to make GDNF. So now not only do you get an astrocyte, but it's pumping out a growth factor, which can't normally get across the blood-brain barrier. So you've created a dual therapy, really, an astrocyte stem cell replacement and a protein therapy, GDNF, which is, we call it ex vivo gene therapy. And we've taken that into a patient trial for ALS that we've just completed, putting those in the spinal cord of ALS patients, and we're planning to do one in Parkinson's. So that's my side of the lab that's more patient-orientated in terms of clinical trials. And then the other side of my lab models diseases using induced pluripotent stem cells. But there the question is, what causes Parkinson's? What causes ALS? And using this technology, we can take stem cells from the patient, reprogram them back in time, and then make the dopamine neurons that die in the disease and look at them under the microscope and look at them in the petri dish. And that's going to give us valuable insight, new models of Parkinson's or ALS or Alzheimer's. That's going to be very valuable, I think.